Before watching the video, please subscribe and hit the like button. When we think about healthcare for seniors, more screenings and tests often seem like the responsible approach. However, emerging research challenges this conventional wisdom, suggesting that many health screenings after age 70 may actually diminish quality of life rather than enhance it. A groundbreaking study from Harvard Medical School reveals a startling statistic: approximately 68% of adults over 70 undergo unnecessary medical tests. These screenings, often the same ones recommended for younger adults, frequently lead to needless anxiety, invasive follow-up procedures, and treatments that provide little benefit while introducing new risks. The paradox of modern geriatric care lies in this uncomfortable truth. Medical interventions beneficial to younger populations can become harmful as we age. Our bodies change dramatically over time. Yet many screening protocols remain rigidly standardized across age groups, failing to account for these natural transformations. Consider the cascade effect that often follows an incidental finding on a routine scan leads to additional testing, which discovers a minor abnormality that would likely never cause symptoms. This triggers treatments with significant side effects in elderly patients whose bodies process medications differently. The result? A diminished quality of life. Pursuing health at the expense of well-being. Medical professionals are increasingly advocating for a more nuanced, personalized approach to senior health care, one that carefully weighs potential benefits against risks and focuses on maintaining function and joy, rather than detecting every possible abnormality. This shift represents a profound recalibration in how we define good health in our later years, emphasizing quality of remaining life over medical intervention at all costs. The risks and problems of health screenings. 5 key issues. 1. Age-related physiological differences. The human body undergoes significant transformations as it ages. Yet most screening protocols fail to adequately account for these natural changes. Medical standards and normal ranges are typically established using data from younger adults, creating a fundamental mismatch when applied to elderly patients. What appears as a concerning result on paper may simply reflect normal aging, rather than a pathological condition requiring intervention. For instance, slight elevations in blood pressure or cholesterol that would trigger immediate treatment in a 50-year-old might represent a beneficial adaptation in someone over 80. Forcing elderly bodies to conform to youthful standards can disrupt delicate physiological balances established over decades. 2. Inherent risks of screening procedures. As we age, our bodies become more vulnerable to complications from screening procedures themselves. A colonoscopy, considered relatively routine for middle-aged adults, carries 4 times greater risk for patients in their 80s compared to those in their 40s. The preparation alone can cause dangerous electrolyte imbalances and dehydration in frail seniors. Similarly, contrast dyes used in imaging studies pose increased kidney damage risks, and even seemingly benign procedures, like mammograms, become more painful and potentially harmful due to changes in skin elasticity and breast tissue density. 3. Medication side effects. When screenings lead to diagnosis, medications often follow, and elderly patients experience drug side effects with greater frequency and severity. Their bodies metabolize and clear medications differently, making adverse reactions more common and more dangerous. Statins prescribed for cholesterol management frequently cause debilitating muscle pain in older adults. Blood pressure medications increase fall risks through orthostatic hypotension. The cure often introduces problems worse than the condition being treated, particularly when that condition might never have become symptomatic. 4. Financial burden. The economic impact of unnecessary screenings extends beyond direct medical costs. Fixed-income seniors often face difficult choices between paying for prescribed tests and treatments versus maintaining their quality of life through other expenditures. Insurance rarely covers all expenses, and the financial strain can deplete resources meant to provide comfort and dignity in one's final years. This burden becomes particularly problematic when considering the limited potential benefit. Spending thousands of dollars detecting and treating conditions unlikely to affect lifespan or function represents a poor investment in actual well-being.
5. Psychological impact.
Perhaps most overlooked is the psychological toll of medical testing on elderly patients. Anxiety while awaiting results, fear upon receiving ambiguous findings, and distress during follow-up procedures can significantly diminish mental well-being. This chronic stress negatively impacts immune function and overall health. Many seniors report that the weeks spent anxiously awaiting test results
Represent some of their most miserable times.
often followed by invasive procedures that leave them physically weakened and emotionally drained, all for conditions that might never have affected their daily lives if left undetected. 5 essential screenings for senior health. While many screenings may be unnecessary or even harmful for older adults, certain health assessments remain vital for maintaining quality of life. In the senior years, these 5 screenings offer substantial benefits with minimal risks when properly administered. 1. Blood pressure monitoring. Hypertension remains the silent killer at any age, often presenting no symptoms until a catastrophic event occurs. Regular blood pressure checks can detect dangerous elevations before they lead to stroke, heart attack, or kidney damage. For seniors, proper monitoring should account for age-appropriate targets, rather than applying the same standards used for younger adults. 2. Diabetes screening. Detecting elevated blood sugar levels early can prevent serious complications in older adults. The beauty of diabetes screening is that early intervention often requires only lifestyle modifications, improved diet, modest exercise, and weight management, rather than aggressive pharmaceutical approaches. This represents preventive medicine at its best. High benefit, low risk intervention. 3. Bone density testing. Osteoporosis silently weakens bones until a minor fall results in a devastating fracture. Particularly for postmenopausal women, periodic bone density screening can identify concerning changes before fractures occur. This knowledge enables targeted interventions like appropriate exercise, calcium supplementation, or medication when truly warranted. 4. Vision and hearing assessments. Sensory impairments profoundly impact senior health yet are frequently overlooked. Diminished vision or hearing often leads to social isolation, depression, cognitive decline, and increased fall risk. Regular screening can detect correctable problems and facilitate appropriate interventions, from simple hearing aids to cataract surgery, that dramatically improve quality of life. 5. Depression screening. Mental health deserves the same attention as physical well-being. Depression in seniors often presents differently than in younger adults and can be mistakenly attributed to normal aging. Simple screening questionnaires can identify those suffering silently, opening pathways to effective treatment through counseling, social support, or carefully selected medications when necessary. The importance of personalized health care. Beyond the essential screenings, truly effective senior health care requires a personalized approach that considers the unique history and circumstances of each individual. This tailored strategy creates the optimal balance between necessary vigilance and avoiding unnecessary medical interventions. Family history should significantly influence screening decisions. Those with strong genetic predispositions to heart disease may benefit from cardiac assessments that would be superfluous for others. Conversely, seniors without relevant family histories might safely forego certain screenings despite general recommendations. Lifetime habits also dictate appropriate monitoring. Former smokers warrant periodic lung evaluations that non-smokers might reasonably skip. Similarly, those with histories of sun exposure benefit from regular skin examinations, while others may need them less frequently. Medication regimens necessitate specific monitoring protocols. Many common medications for arthritis require liver function tests, while others may demand regular kidney function assessment or electrolyte monitoring. These tests represent necessary surveillance rather than excessive screening. Central to effective personalized care is a trusting physician-patient partnership. Finding a doctor who listens carefully, respects autonomy, and understands that more testing doesn't always equal better care becomes increasingly valuable with age. This relationship, combined with meticulous personal health record maintenance, ensures that medical decisions remain aligned with both physical needs and personal values. The importance of daily habits. After age 70, the foundation of true health shifts dramatically from medical interventions to daily lifestyle practices. While screenings and treatments certainly play a role, research increasingly confirms that ordinary daily habits exert far greater influence on quality of life and functional independence than periodic medical examinations ever could. Physical activity, the cornerstone of senior vitality. Regular, gentle movement provides benefits no medication can match. Daily walking, swimming, tai chi, or chair yoga improves cardiovascular health, maintains joint mobility, enhances balance, and boosts mood through natural endorphin release. The ideal exercise for seniors is whatever they enjoy enough to continue consistently. Low-impact activities that raise the heart rate slightly without causing pain or excessive fatigue. Protein intake preserving muscle mass. Age-related muscle loss sarcopenia accelerates after 70, but proper nutrition can significantly slow this process. Seniors need protein sources that are easily digestible and gentle on aging. Digestive systems, soft-cooked eggs, Greek yogurt, tender fish, bean purees, and protein-enriched smoothies. Distributing protein intake throughout the day, rather than consuming it all at dinner, optimizes muscle maintenance. Hydration conscious fluid consumption. The sensation of thirst diminishes with age, making dehydration a serious yet underrecognized risk. Seniors benefit from scheduled hydration, drinking water or herbal tea at regular intervals throughout the day, rather than waiting until thirst, which may never adequately manifest, prompts them to drink. Proper hydration supports kidney function, prevents urinary tract infections, and helps maintain cognitive clarity. Sleep hygiene, the restorative power of rest. Sleep architecture changes with aging, but quality rest remains essential. Establishing consistent evening routines signals the body to prepare for sleep. Perhaps gentle stretching, warm baths, calming music, or meditation Reducing screen time before bed and maintaining regular sleep-wake schedules helps maximize the body's natural repair processes that occur during slumber. Social connection, the medicine of companionship. Isolation poses health risks comparable to smoking 15 cigarettes daily. Regular social interaction, whether through community centers, religious organizations, volunteer work, or family gatherings, provides cognitive stimulation, emotional support, and a sense of purpose that profoundly impacts health outcomes. Even brief daily social contacts can significantly boost immune function and mental well-being. Self-awareness, the daily check-in. Perhaps most fundamental is the practice of attentive self-monitoring. Taking a few moments each day to notice energy levels, mood, physical comfort, and cognitive clarity. This mindful awareness enables early recognition of concerning changes and reinforces the connection between daily habits and how one feels. Many seniors benefit from keeping simple journals tracking their daily experiences and activities. As we reconsider health in our later decades, a profound truth emerges: the goal shifts from simply extending life to enriching the quality of our remaining years. This perspective transforms how we approach healthcare decisions with age and wisdom. The most meaningful measure of health in our senior years isn't found in laboratory values or screening results, but in our capacity to continue engaging in activities that bring us joy and purpose. True health means having sufficient energy and function to read to grandchildren, tend a garden, create art, volunteer in the community, or simply enjoy a meal with loved ones. Wisdom in aging involves recognizing what matters most. Rather than pursuing every possible medical intervention or screening, we might instead invest our precious time, energy, and resources in what truly nourishes our spirits. This selective approach isn't about giving up on health. It's about defining health more holistically. The most profound healthcare decision we can make as we age may be to shift our focus from anxiously monitoring for disease to mindfully cultivating well-being. By balancing necessary medical vigilance with deliberate celebration of life's continuing gifts, we honor the true purpose of health in our golden years, not merely surviving, but genuinely thriving in ways that matter most to us. If you enjoyed watching this video, please subscribe and hit the like button.